Welcome back to the Physiology of the Gastrointestinal Tract lectures. And in the past couple lectures, what I've done is I gave a general introduction about this system, the gastrointestinal tract. We defined the system. I gave a general overview of the main components of the system. Then the histology of the gut wall. And then we start talking about the control systems that orchestrate the different functions of the gut. It's always important to keep in mind the definition of the gastrointestinal tract. It's a tube-like structure that extends from the mouth to the anus and provides the body, including itself, with nutrients, water, and electrolytes by performing four functions: digestion, secretion, absorption, and motility. We also talked about the different parts of the gut: stomach, small intestine, and large intestine. Then the histology of the gut wall: mucosa, submucosa, muscle layers, and serosa. Between these layers, there are two ganglionated nerve plexuses: the mesenteric plexus, sandwiched between the outer longitudinal muscle layer and the inner circular muscle layer, and a submucosal plexus located underneath the submucosal layer. I also talked about the control systems that orchestrate the different functions of the gastrointestinal tract. I mentioned that you have two control systems, one that is located inside the wall of the gastrointestinal tract. We called that intrinsic control system. And there's a system that is located outside the wall of the gastrointestinal tract, and we call that extrinsic control system. Each of these systems, the intrinsic and the extrinsic, contains nerves and endocrine secretions. Last lecture, I talked about the nerves of the intrinsic control system of the gastrointestinal tract. We call that the enteric nervous system, or the ENS. We said that it has hundreds of millions of neurons. Therefore, we had to have a certain criteria to simplify the understanding of this system. And we talked about three different criteria: the morphology, based on their shape of the cell bodies; electrophysiology, based on the electrical properties of these neurons; and based on the content of these neurons. We called the first criteria morphology. We called the second criteria electrophysiology, and we talked about the third criteria being chemical coding, or the type of neurotransmitters that being released from the enteric neurons. We said the morphology, they have Dogeal type 1 and Dogeal type 2. We said that the electrophysiology, we have two types: S, or synaptic type, and AH neurons, or after hyperpolarization. And based on the chemical coding, the enteric neurons consist of either inhibitory or excitatory neurons that release, if they are inhibitory, VIP or vasoactive intestinal peptide and nitric oxide, NO. And if they are excitatory neurons, then they will release either substance P or acetylcholine. In addition to the enteric nervous system, I also mentioned a very important component of the intrinsic control system of the gut, and that is the interstitial cells of Cajal, ICCs. These are specialized cells that produce what we will call slow waves, which has 4 different electrical phases: resting, rising, plateau, and falling. And also I mentioned that the plateau phase is the most important phase in the slow wave. That is because it will be joined with the action potential that's coming from the enteric neurons to cause contraction. This is the requirement for gut contraction, is to have an action potential coming from the enteric neuron and a plateau phase that's coming from the slow wave of the ICC. We learned that the ICC are specialized cells or pacemakers of the gut, which means that they can generate electrical activity on their own. So this is basically all what I want to say about the intrinsic neuronal control system of the gut. In the current lecture, I will talk about the extrinsic nerves that control the functions of the gut. Before we talked about the intrinsic neurons, the neurons within the wall of the gastrointestinal tract. Now I will be talking about the nerves located outside the gastrointestinal tract. Yet they control the functions of the gastrointestinal tract. At least they participate in this control, because I also mentioned that the enteric nervous system is part of the autonomic nervous system, which basically functions on its own. The gut has a brain of its own, which we call the ENS, or the enteric nervous system. Even if we cut the connections between the central nervous system, which is the brain and the spinal cord, and the gastrointestinal tract, still the gastrointestinal tract will continue to function. This is a pretty important characteristic of the autonomic nervous system, or the enteric nervous system of the gut, the ENS. Again, in this lecture, what I will be talking about is the extrinsic innervation that controls the gastrointestinal tract. We have seen this slide before, and this slide basically is the roadmap by which we continue our discussion on the control systems of the gastrointestinal tract, or the systems that orchestrate the different functions of the gut. An intrinsic system and an extrinsic system. A system that's located inside the gut wall and a system that's located outside the gut wall. Each of these systems contain nerves and endocrine secretions. We talked about the nerves of the intrinsic system, the ENS and the ICCs. Today, we will be talking about the nerves of the extrinsic control system. There are two nerves that participate in the control of the gastrointestinal functions. These nerves are the vagus nerve, the 10th cranial nerve, and the splanchnic nerve. Vagus nerve and splanchnic nerve. This is a diagram that shows the different layers of the gastrointestinal tract. We have seen this when we studied the histology of the gastrointestinal tract. We have the mucosa, which consists of 3 different layers: epithelium, lamina propria, and muscularis mucosae. Then we have a submucosa. Then we have 2 muscle layers, outer longitudinal and inner circular. And finally, we have a serosa. Sandwiched between the inner circular and the outer longitudinal muscle layers is the myenteric plexus, part of the enteric nervous system. Underneath the submucosa, there is the submucosal plexus, the second component of the enteric nervous system. Now, the enteric nervous system, as well as the different layers of the gastrointestinal tract, are also supplied by 2 extrinsic nerves. When I say extrinsic, I mean nerves that are outside the gastrointestinal wall. These nerves are the vagus nerve and the second nerve is the splanchnic nerve. The vagus nerve is labeled 1 in this diagram, and the splanchnic nerve is labeled 2. One and 2 form the extrinsic innervation of the gastrointestinal tract. And each of these nerves contain efferent fibers and afferent fibers. Efferent and afferent fibers. Fibers that sends the signal to the central nervous system, and fibers that receives orders from the central nervous system and send them to the gastrointestinal tract. That's why there are 2 circles, including 2 lines for each nerve. One, you can see inside the circle 2 lines, one dotted and one is straight. They basically denotes the efferent and the afferent fibers of the vagus, as well as in number 2, the efferent and the afferent fibers of the splanchnic nerve. Now, we have to spend a little time on this slide to simplify it and to make sure that we understand it. Of course, the A, V, and L, the red, blue, and green lines in the middle of the diagram represent the artery, vein, and lymphatic vessels that supply the gastrointestinal tract. Now back to the nerves 1 and 2. 1 is the vagus nerve. 2 is the splanchnic nerve. The vagus nerve, which is 1, consists of mostly parasympathetic fibers, whereas number 2, the splanchnic nerve, represent the sympathetic innervation of the gastrointestinal tract. So we have parasympathetic and sympathetic innervation of the gastrointestinal tract. 1 through the vagus nerve, 1, and 2 through the splanchnic nerve, or the sympathetic nerve. Now, the vagus nerve has its cell body located in a ganglia slightly underneath your ear, and it's called the nodose ganglia. This is denoted in this diagram by a little yellow circle called NG. NG stands for nodose ganglia. This is where the cell bodies of the afferent vagal fibers are located. The efferent cell bodies are located in the hindbrain, especially in the brainstem, in a nuclei that's called the dorsal vagal complex. This dorsal vagal complex consists of 3 nuclei: area postrema, one of the circumventricular organs in the central nervous system, which means that it lacks the blood-brain barrier. That's what circumventricular organ mean. The other nuclei is the dorsal motor nucleus of the vagus, DMV, and the third nuclei is the nucleus of the solitary tract, or nucleus tractus solitarius, NTS. So the NTS, the DMV, and the AP, or the area postrema, form the dorsal vagal complex, or the DVC, shown here. So the vagus leaves the brainstem and travels to different organs in the abdominal and in the thoracic cavities, lungs, heart, etc. And then it comes to the gastrointestinal tract and it gives three different afferent fibers labeled in Roman numbers here 1, 2, and 3. 1, 2, and 3 Roman numbers. Now, one is called intravillous arbors, IVA. This intravillous arbor vagal afferent reach all the way to the villi of the enterocytes to basically sense the signal in the lumen of the gut and send it to the central nervous system. That is why it's an afferent. Starts with an A. Sends the information to the central nervous system. The second vagal afferent is called interganglionic laminar ending. Interganglionic laminar ending. IGLE. Interganglionic laminar ending. This afferent fiber of the vagus reaches the two plexuses of the enteric nervous system, the myenteric plexus and the submucosal plexus. That's why it's called interganglionic. It reaches the ganglia. It synapses with the ganglia of the myenteric and the submucosal plexuses to take information from there and again send them to the central nervous system. That is why, again, it's called an afferent. It takes the information from the gut, especially from the myenteric and the submucosal plexuses, and send them to the central nervous system, to the DVC, to the dorsal vagal complex, which consists of the three nuclei, area postrema, AP, NTS, nucleus tractus solitarius, and DMV, or dorsal motor nucleus of the vagus. The third intervagal fiber is called intermuscular arrays. Intermuscular arrays, denoted here in the Roman number 3, or by the Roman number 3. This afferent reach the muscle layers of the gut. That's why it's called intermuscular arrays. The fibers reach the muscles of the gut wall, and again it gets information, collects information, and sends it to the central nervous system, to the DVC again. So these are the three vagal afferents of the vagus. Intravillous arbor, intraganglionic laminar endings, and intermuscular arrays. All of these cell bodies for these afferent are located in the nodose ganglion. The cell bodies of the efferent part of the vagus, which is number 1 in this diagram, are located in the dorsal vagal complex, especially in a nuclei that's called DMV, or dorsal motor nucleus of the vagus. That's where the information from the brainstem or the hindbrain are sent to the gut. Efferent. The orders are coming from the higher centers in the central nervous system, especially the DMV, through the efferent arm of the vagus nerve to the gut to control the functions of the gut. This is basically the vagus nerve, which mostly is parasympathetic in nature. 85% or even more sometimes are parasympathetic. The second extrinsic innervation of the gastrointestinal tract is the sympathetic innervation. We talked about the parasympathetic, the vagus. Now we will talk about the sympathetic innervation. And the sympathetic innervation of the gut is supplied by the splanchnic nerve, denoted as number 2 in this diagram. Number 2 is the splanchnic nerve. Now again, it has efferent and afferent fibers that sends the information to the spinal cord and then to the brain, and then fibers that takes orders from the brain and the spinal cord and send them back to the gut. Now, there are 2 orders of neurons for the sympathetic innervation, or for the splanchnic nerve that supplies the gut. The first order neurons, the cell bodies of these neurons, are located in the thoracolumbar area of the spinal cord, especially in the dorsal root ganglia, along the spinal cord, along actually the vertebral column, to be very specific. Very, very attached to the vertebra. The dorsal root ganglia. This is where the first order neurons of the sympathetic innervation are located. These neurons reach a ganglia we call the Celiaco-Mesenteric Ganglia, or the CMG in this diagram. CMG, or the Celiaco-Mesenteric Ganglia, is the ganglia that contains the second order neurons of the sympathetic innervation of the gut, which is the splanchnic nerve. So the first order neurons are located, or the cell bodies of the first order neurons are located in the dorsal root ganglia along the vertebral column, spinal cord, and the second order neurons are located in the celiaco-mesenteric ganglia, celiaco-mesenteric ganglia, or CMG, CMG. From there, the fibers go to the different layers of the gastrointestinal tract: serosa, muscles, submucosa, mucosa, and mesenteric and submucosal plexuses, and they innervate the, those layers. Now they collect information from these layers and they send orders from the brain and the spinal cord to these layers to function, either motility or secretions or other things. So we have seen that the extrinsic innervation of the gastrointestinal tract, or the nerves that are located outside the gastrointestinal tract, but they control the functions of the gut, are two nerves: vagus, mostly parasympathetic, and splanchnic, sympathetic. Each one of them, each of these nerves, 1 and 2, contain afferent and efferent fibers. The afferent fibers of the vagus are located in the nodose ganglia, and the efferent fibers are located in the DMV, or dorsal motor nucleus of the vagus. The afferent branch of the vagus has 3 afferents that reach to different layers in the gut: intravillous arbors, interganglionic laminar endings, and intermuscular arrays. The splanchnic nerves have afferent and efferent, and the first order neurons are located in the thoracolumbar area of the spinal cord in the dorsal root ganglia, and the second order neurons are located, or the cell bodies, I should say, of the first or the second order neurons are located in the celiaco-mesenteric ganglia. So the cell bodies of the first order neurons are located in the dorsal root ganglia, whereas the cell bodies of the second order neurons of the sympathetic nerve of the gut, which is the splanchnic nerve, are located in the celiaco-mesenteric ganglia. This celiaco-mesenteric ganglia, I'll show it to you later, is located between the celiac artery and the cranial mesenteric artery, branches of the aorta that supplies the gastrointestinal tract. We'll look at it in a second. But here, I would also like to mention to you that these nerves are very important from a clinical standpoint. Just like the esophageal achalasia that we've talked about, and myotomy, and cutting the different muscle layers of the gut to treat it, just like what we talked about, the different obstruction cases, either normal or real or pseudo obstruction, and different motility patterns with the loss of the ICCs, interstitial cells of Cajal, or the loss of the innervation to the sphincter of Oddi, or Oddi, that opens for the bile secretions and the pancreatic secretions into the upper duodenum. All of these are clinically important. The same thing is the two nerves here, the vagus nerve and the splanchnic nerve. These are important nerves from a clinical standpoint, and I'll show you how. This is basically where the 3 vagal afferents that we've talked about are: the intervillous arbors, the intraganglionic laminar endings, and the intermuscular arrays, IVA, IGLE, and IMA. All 3 vagal afferents receive information from certain areas in the gut wall, and they send this information to the central nervous system. This is to the dorsal vagal complex, DVC, in the previous picture. Intravillous arbors, from the name, they collect information from the villi all the way in the lumen of the intestine. The intraganglionic laminar ending, they collect information from the ganglia of the enteric nervous system, both myenteric and submucosal plexuses. The intramuscular arrays, they collect information from the muscle layers of the gut, and they send that information again to the central nervous system in the dorsal vagal complex, in the hindbrain or in the brainstem. So these are the vagal afferents that collects the information. Okay. Now, how are these important clinically, or are they important clinically? And the direct answer to this question is absolutely. One of the cases that I've talked to you about in my introductory lecture is gastric ulcers, especially if you're doing equine medicine, especially if you work at the racetrack. I told you over 75, over 80% of horses which race, they have gastric ulcers. I showed you these pictures before. Just to remind you, the white arrow points at a nice light pink tissue. That's the normal tissue of the mucosa of the stomach, whereas the other arrow, or the blue or the dark blue arrow, is pointing to the inflamed tissue in the stomach. This is the gastritis case in the canine that we talked about earlier. This is the left-hand side picture. On the right-hand side picture, you will see an equine stomach that has multiple ulcerative lesions. Again, in racehorses, that's pretty common. Both of these cases, gastritis or gastric ulcers, EGUS, both of them are basically due to hyperacidity, increased gastric acid secretions. This is one of the main reasons for these cases. Not the only reason, but one of the main reasons is hyperacidity. And therefore, one of the treatment options for these cases is what we call selective branch vagotomy. Selective branch vagotomy is basically cutting or severing a branch of the vagus nerve that supplies the area with the most prominent lesion. Selective branch vagotomy is severing or cutting a branch of the vagus nerve to treat gastritis or ulcers in certain regions of the stomach. The vagus nerve has different branches: hepatic, accessory celiac, celiac, left gastric, right gastric. Now, each of these branches go to certain areas in the stomach. Based on the diagnosis of the clinician, which area of the stomach being affected with either ulcer or gastritis, we cut the branch of the vagus that supplies that particular region. That is what we refer to as selective branch vagotomy. And it's a common surgery. So the vagus and the splanchnic nerve, as I'll show you later on, are clinically important and are clinically relevant. Selective branch vagotomy is a treatment or one of the treatment options for gastritis or ulcer due to hyperacidity, because acid secretion is partially mediated by the vagus nerve. So cutting that branch of the vagus may reduce acid secretion and as a result will decrease the ulcer or the inflammation of the stomach. This is a picture from our laboratory, actually, of the celiaco-mesenteric ganglia that is located between the celiac artery and the cranial mesenteric artery, which are branches of the aorta. The arteries, the aorta, celiac, and cranial mesenteric artery, are clearly seen in B. However, in A, they are covered with this milky looking tissue. That milky looking tissue is the ganglia itself. So in A, you have the ganglia intact, and in B, you have it removed. The ganglia is removed. The celiaco-mesenteric ganglia is removed. That is what we call celiaco-mesenteric ganglionectomy. Ganglionectomy is removal of the ganglia, of the celiaco-mesenteric ganglia. It's a microscopic surgery that requires removal of the ganglia from between the celiac artery and the cranial mesenteric artery. This surgery is done for a number of cases listed here. First, it can be done to decrease long-term pain. Long-term pain. Second, and that's more in humans, decrease excessive sweating, especially in the palms of the hands. A third indication for the surgery is to increase blood flow to an area. So if the area is lacking blood flow, sympathectomy might be utilized to increase blood flow to that area. So 3 different indications for the surgery I enlisted here: decrease long-term pain, decrease excessive sweating, and increase blood flow. Now, I've talked about the extrinsic innervation of the control systems of the gut, which consists of 2 nerves: a vagus nerve and a splanchnic nerve. We're back to the roadmap that we have from the beginning of these lectures. The roadmap that divided the control systems of the gastrointestinal tract into two systems. One that is located inside the gut wall, we call that intrinsic, and one that is located outside the gastrointestinal tract, and we call that extrinsic. Each one of these systems consists of nerves and endocrine secretions. Nerves and endocrine secretions. The nerves for the intrinsic control system are the enteric nervous system as well as the interstitial cells of Cajal. I want you to remember that ICCs, or the interstitial cells of Cajal, are not neurons. These are specialized cells, but I include them here because they are the pacemakers of the gut, and they generate slow waves, and we need the plateau phase of the slow wave to be combined with the action potential from the enteric neuron to make a contraction. Otherwise, contraction will not take place. It will not happen. We've talked about that. In this lecture, I've talked about the nerves that form the extrinsic control system of the gastrointestinal tract. And these nerves are two nerves: vagus nerve, mostly parasympathetic, and splanchnic nerve, sympathetic nerve. I talked where they are located, where their cell bodies are, different afferent and different efferents, and what are the indications or the surgical indications to utilize these nerves. Vagotomy or selective branch vagotomy to treat hyperacidity, ulcers, and gastritis treatment, part of the treatment at least, or a treatment option, one of the treatment options, and Celiaco-Mesenteric Ganglionectomy to decrease long-term pain and things like that, or decrease sweating and increase blood flow and things like that. In the next lecture, I will be talking about the endocrine secretions of the intrinsic control system of the gut. The endocrine secretions of the intrinsic control system of the gut. These secretions are secretin, gastrin, cholecystokinin or CCK, GIP or gastric inhibitory peptide, and motilin. 5 different hormones that comprise the endocrine secretions from the intrinsic control systems of the gastrointestinal tract.